Today on Otano Podcast, we are discussing the African Medicines Agency and what comes next. It's been almost exactly 2 years since the ratification of the African Medicines Agency Treaty. And my guest today is Mrs. Chimwemwe Chamdimba, who is currently heading the efforts at the African Medicines Regulatory Harmonization Initiative, which is the precursor of the African Medicines Agency. I asked Chimwemwe what progress has been made so far with the African Medicines Agency, what comes next, and when can we expect the agency to begin its work? Chimwemwe, it's great to have you on Otano Podcast.
Thank you for having me today.
You're most welcome. Now, let's dive right in. You are leading the efforts to bring the African Medicines Agency to life. Can you begin by giving us a sense of where you are with those efforts and with that work?
You started very well when you indicated that I'm working with the African Medicines Regulatory Harmonization Initiative, which is the precursor to the African Medicines Agency. And rightfully so, it is a precursor to the African Medicines Agency. So I would say that normally when I'm asked the question, where are we with the African Medicines Agency? I always say that the African Medicines Agency has been up and running since 2009. When we started the African Medicines Regulatory Harmonization Initiative. Because for the African Union to realize that it is now the right time for us to form the African Medicines Agency, it means they noted that a lot of progress has been made when it comes to harmonizing the regulatory systems for medical products across the continent. So we are making quite good progress. We are moving in the right direction. We have set up technical processes and technical guidelines, technical standards that are required to take off the African Medicines Agency. So when we started in 2009 with the African Medicines Regulatory Harmonization Initiative, we already knew where we wanted to get to as a continent. We already knew that for us to really make a difference and for us to have a game changer when it comes to access to the needed medical products and technologies for the African population, we needed to work together as African countries. So we hope that with the African Medicines Regulatory Harmonization Initiative, which we started with the regional economic communities. So we are starting from a point where we had so different regulatory systems and processes across the continent. We had so different, the standards, the guidelines, the requirements for getting into the markets of the African countries when it comes to medical products and technologies were so diverse to the extent that the 55 member states for a manufacturer to get into, if they want to go into the 15 of the 55, it means they needed to navigate 15 standards requirements for registration of medical products. What does that mean? That means time. That means the cost. But, the cost, we cannot just say it's a cost to the manufacturer. Admittedly, it goes to the patient because whatever cost the manufacturer gets into, it is transferred to the patient. So it really increases our cost of healthcare on the continent. So we needed a system that was streamlined, that was harmonized, that would ease the entry of products into African markets. Those that are produced locally, that was our priority because we were responding to the African Union's call to increase local production of medical products, which was made in 2005 through the adoption of the Pharmaceutical Manufacturing Plan for Africa. So yes, we started then. There's a lot of progress that was made. And as AU, what we are saying is that we are not going to start from zero. We are starting from things that are already ongoing. So since the treaty came into force in 2012, what we did is that as AU, we organized ourselves. In 2021, we realized that we needed to organize ourselves. We needed to come together as AU entities and think through how best to do this, to then make this an agency. We need to create an institution. And when you are creating an institution, there are a lot of things that come into play. There are administrative and governance issues that come into play. There are technical issues that come into play. There are processes that have to be developed for the institution. So we knew that as AU, we needed a diverse group of expertise that needed to come together to make sure that we make African Medicines Agency a reality, and starts with the scientific excellence that we are looking for. So we have the African Union Commission, our colleagues at our headquarters in Addis Ababa. They are looking at the governance and administrative issues, because that's their role. They are our policy entity of the AU. They are guiding us when it comes to setting up governance structures, just like our division of labor is within the African Union. And ourselves, from the African Union Development Agency, AUDA, we've been driving the African Medicines Regulatory Harmonization since its inception. And as we said, this is the foundation of the African Medicines Agency. So our role mainly is to drive the technical aspects of the African Medicines Agency, building on the work that we have been doing through the AMRH, the technical assets that we have built over the years. So we are driving the technical development of the African Medicines Agency. And our colleagues at the Africa CTC also become critical, because we want from the very word go to make sure that the African Medicines Agency is responsive to the challenges that are faced by the continent. And for us to really have a feel of those challenges when it comes to public health issues, then the Africa CDC has an important role to give us the pointers as to where the priorities should be when it comes to medical products and technologies that AMRH should focus on. So we have formed a task team of the three of us, of the three institutions, that are driving the work on the operationalization of the African Medicines Agency. So as we sit today, there's progress both on the technical as well as on the administrative side. Currently, I think we are proud to say that the African Medicines Agency is the second fastest treaty to come into force for the African Union.
If I could just jump in, Chimwemwe. So how many of the big countries, the big economies have already ratified? Because there was some concern at some point that countries like South Africa, Nigeria weren't ratifying fast enough, and that there was a need to signal support from the biggest African economies. Have those countries now ratified?
Those countries, some have ratified and some are taking bold steps. And I think the fact that you agree with me that ratifying a treaty is not a technical process. It is a technical and a political process. And as this is unfolding, it really considers so many aspects and so many facets. What implications does the treaty have to the local economy? What does it mean to the health of the population? What does it mean to trade in pharmaceuticals? So they really, as countries, and you agree with me that as big countries, then they have to zoom in and reflect on this and really ensure that by the time they ratify the treaty, they are confident that, yes, this is how we are going to handle it. But to me, I would like to say that the interest is there. They have taken bold steps. These countries have not just sat back. Some of these countries that you already referred to have already signed. Cabinet has already approved. For the South African situation that we are talking about, the treaty is with is going to Parliament. And it means it has gone through a lot of steps. It has already gone through the technical, it has already gone through the cabinet, the ministers, but it then has to get to Parliament for Parliament to then finish the ratification process. So it is an ongoing process. We are in constant engagement with the government of South Africa so that we support wherever we can to make sure that this process goes on smoothly and the ratification is done by the country. But there are also countries like Ghana that has already ratified the AMRH Treaty. We've seen countries like Kenya recently. And you know, Kenya has also a pharmaceutical industry that is thriving. It has ratified the AMRH Treaty and so many others. And I think for the AU to have 26 countries ratifying a treaty in 2 years of its life, it has not happened.
Yes, it is before. Good progress.
So out of the 55, as I said earlier, as I was saying, this is the second most fastest treaty to come into force. If you ask me which is the first one, it is the ACFTA treaty. The ACFTA, countries realized that we needed to trade amongst ourselves. And one of the pillars of the ACFTA is pharmaceutical manufacturing, by the way, pharmaceutical trade. So it just makes sense that for us to unlock continental trade and investment in pharmaceuticals, we have to take care of the regulatory systems and standards. And the African Medicines Agency and the work that we are doing through the AMRH then becomes central and pivotal to the process. So we are working with the countries. We are going to be convening in Tanzania, right? I think in the next few weeks to engage with Parliament, because the Cabinet has also approved the treaty to go into Parliament for the ratification. So it tells you the momentum and how we are moving. Egypt for North Africa. So you can see across the continent, from east, west, south, central, we are seeing even north. A lot of northern countries have done that. Morocco, Egypt have already done that. So we can see that the momentum for the continent is there.
And what about Nigeria, Chimwemwe? You've mentioned all these others: Tanzania, Kenya, South Africa, Egypt. Yes. What about Nigeria? They have a pretty big pharmaceutical manufacturing base.
Yes, we are currently in engagement with Nigeria. We are discussing with Nigeria, and we are actually working with them to put in place a process of ratifying the treaty. And we cannot say that Nigeria is not interested. Nigeria is interested, but as we say, we need to engage. We need to, come together and dialogue and see how we take forward the treaty. So we are definitely in partnership with Nigeria. By the way, the head of agency for Nigeria was just our previous chair of the steering committee of the African Medicines Regulatory Harmonization Initiative. And Nigeria is also participating in one of our key initiatives on safety surveillance for medical products. And they are chairing our interim committee on substandard and falsified medical products across the continent. It just tells us that Nigeria really is open to working with the continent, really is open to support the continental processes and continental initiatives. So we are working with Nigeria on the harmonization initiative, and we are working with them to ensure that we navigate the processes that have to do with ratifying the African Medicines Agency Treaty.
Now, you mentioned, obviously, when you started in 2009, you were very clear where you wanted to go. Everybody was starting from different places, but it seems, just observing the development, it seems that there has been an acceleration in terms of what countries themselves are doing to strengthen their own capacity at a national level. And of course, the African Medicines Agency is going to succeed only if the national medicines regulatory authorities have very strong capacity at national level. Now, when the process of AMA started, I think there were very few countries that were operating at maturity level 3. I remember there's Tanzania. And in the past year, we've seen an acceleration, perhaps, of this process. How many countries are now operating at maturity level 3, and how many more can we expect, to see raising their level in the next 12 months?
You are totally right to say that we have accelerated when it comes to country capacity. And I really like the fact that you have emphasized the fact that AMA will only succeed if the national regulator is strong, if the national regulator has level of capacity to absorb AMA decisions. There are two things that AMA will solely depend on countries. Firstly, the issue of experts, because how AMA will operate, if you look at the AMA treaty, it will operate through continental technical committees. And the experts for the continental technical committees are going to come from the national regulatory authorities. What does that mean? That means that we need to have capacity at the national level to be able to provide capacity at the continental level. This is just like the model that European Medicines Agency operates. They use technical expert groups that do the regulatory work at the continental level. Secondly, even if work is done at the continental level, a review, for instance, is done of a dossier for application of registration of product. And there's a report that has been endorsed at the AMA level. For this report to be implemented, AMA will not implement on its own. AMA will require national level regulators to be able to take up the decision and implement it at the national level. So as a continent, we realized this and we knew that we needed to do something about it. And you can see with the reg programs going on, the momentum for building capacity of national regulators was really high. You talked about Tanzania being at maturity level 3. I would say that currently we have 5 countries that have already attained maturity level 3. We have Ghana, in addition to the Tanzania, that is at ML3. South Africa itself, it is at that level. We have Egypt, that is also in this bandwagon, and Nigeria. What does this mean for the continent? It's a huge plus, because then these countries are able to mentor others, are able to hold hands of the others. We have a program that twins regulatory authorities. So we take a regulatory authority that has made a board commitment. We know Rwanda has made a board commitment. And Rwanda is now partnering with Ghana and other regulatory authorities across the globe to improve their capacity. So the twinning program pairs a strong regulatory authority with one that is striving to improve its capacity, so that they then work together to mentor, build capacity towards improving their level of maturity. We did an assessment just when the treaty came into force to understand the level of capacity, the maturity of the different NRAs, and how they are doing in implementing institutional development plans. Because, you know, for us to attain maturity level, higher maturity levels, we do benchmarking, the WHO benchmarking. And once that is done, an institutional development plan is developed for the NRA to implement. So we really needed to understand, because for us to build capacities at the national level, we needed to know the baseline. Where are they? We have responses from 27 countries. But you will be surprised. There are different levels. Of course, some are at maturity level 1, others at maturity level 2, and the 5 that I've talked about that are at MO3. You can see the impetus, the drive that they have towards improving capacity. And watch this space. Very soon you will see more and more NRAs getting to ML3, ML2, ML1. But I think one thing we should keep in mind is that not all countries are going to be at ML3. Let's accept it. But what we want is that countries should have the basic capacity they need to regulate medical products within their economies. So we are moving countries towards that, so that at least each country has the minimum required capacity to ensure that they are able to regulate effectively their jurisdiction when it comes to medical products.
You say to watch this space. We are definitely watching this space. The host country agreement has now been in place for quite some time with the government of Rwanda. And what many people are wondering is what comes next? When will the agency start to operate, the African Medicines Agency, in name, not just in the form that it currently exists in, but having the plaque, the African Medicines Agency, at the door where people can come and knock on the door and conduct their business?
Mm-hmm. It's very soon, and I think we have taken quite a number of steps as African Union to ensure that we accelerate the formation of the African Medicines Agency. We are thankful to the government of Rwanda that has, of course, as you said, we have already signed the host country agreement. We saw the commissioner and the Minister of Health together signing the host country agreement not so long ago. Soon after that, a few weeks later, we had a meeting of the Conference of State Parties in Rwanda. But I also wanted to thank the government of Rwanda because they have allocated a very beautiful, big building. We already have the office space for AMRH. It's just waiting for the staff to go and occupy in the buildings. And those are the steps that now we are taking. So the meeting of the Conference of State Parties that happened in Rwanda recently, we were looking at the formation of the board, because the governance board of AMRH holds the key to the operationalization. Why am I saying that? It is the governance, it is the governing board that is going to recruit the AMRH DG.
Is that in place?
The board is currently being put in place. We already have nominations from some of the regions because the treaty indicates who are supposed to sit on the board, representing the 5 AU regions, the heads of agencies. We also have a representative from REX, a representative from regional health organizations and ethics committees. So, you know, it has to be a consultative process.
What about civil society? Is it represented on the board?
Civil society is not going to sit on the board because ultimately we have structures and systems that are going to be used to engage civil society as well as the private sector itself, because the industry becomes critical. We can't do everything without consulting with the industry. So we are setting up structures to ensure that there's solid engagement of civil society, patient groups, as well as the private sector as the board is being formed. So we are currently putting in place these structures. We are putting in place the systems so that we ensure that we have a solid check-off structure for the African Medicines Agency. Ultimately, we wanted that by the end of the year, we have something in place. But also, I think another exciting thing is that during the meeting in Rwanda, the Conference of State Parties also looked at the terms of reference for the AMRH Director General. So as we sit today, they are finalized. They are ready to go. The AUC is working on ensuring that we advertise. But as I said, the board then will become important because they are the ones that are going to shortlist the applications, do the interviews, and make the recommendations for the policy structures to then ratify and approve the appointment of the AMRH. So we are really working against time to ensure that this is done in a timely manner. And once we have the DG in place, the interim structure of AMA will be in place. The DG will recruit the staff. And we are already talking about even member state contribution, because we don't want some of these things, the internal issues around capacity, to be funded elsewhere. I think if we can't form our own internal structures, then their sustainability will be doubtful. So the last meeting also talked about that and tasked us as AUDA-NEPAD, AUC, Africa CDC, to look at what are the requirements of AMA financially, so that then we start talking about what will it mean when it comes to member states' contribution, as well as partner engagement.
Yes, you mentioned a really good point on sustainability. That's my next question, in fact, because ensuring that the African Medicines Agency has, you know, a sustainable funding base is one of the most critical pillars that it's going to need for its success, for its longevity, for its ability to actually meet its mandate. But so far, at least from where we are, the most visible pledges of investment that we see or that are, you know, apparent to us are coming from external sources, donors, and the like. What about African countries themselves? Are they investing? Do you have a sense what proportion of the agency's funding needs are going to come from domestic sources with our own governments putting money to sustain the agency?
I wouldn't want to give you a proportion today, because as we are saying, we are currently working on the modalities as to what does that mean? What will be the financing, and what are the key points that will require these resources? We did a business plan at some point, I think it's before the treaty even came into force, but that was about 5-6 years ago when we were figuring out the treaty itself, its requirements, and what would be some of the financing sources. But I think the comforting fact is that the treaty itself talks about 3 main sources of funding for AMA. And the 3 main sources of funding for AMA, the first one that is actually mentioned is the member state contribution. Just like the AU itself has member state contribution, the AMA, as a treaty-based institution, it will receive contribution from its member states. Currently, because we have not yet estimated how much specifically how much each country is going to contribute to the treaty, we already, though, are getting some funding from the AU to drive some of these processes. Not everything is fully funded by partners. No. There's AU contribution that is currently being used to run some of the basic requirements to set up the governance and the administrative aspects of AMA. The second source of funding that is mentioned by the treaty is fees from services rendered, meaning that the African Medicines Agency will be able to charge fees for some of the services that will be rendered, just like the National Regulatory Authority charges fees. And we are also learning from our colleagues at the European Medicines Agency. We have established a partnership with them because we want to learn how, over time, gradually they have grown, they have learned, they have managed to sustain their activities. And we want AMA to learn from at least an existing continental institution that has been able to do the work that we're expecting African Medicines Agency to do. That's the second source of funding, fees from services rendered. The third one is that one that we are, of course, partners that would like to contribute and support the agenda. AMA is still able to do that, to mobilize resources from partners. So as where we're sitting, I think we are comforted by the fact that we already have started engaging on understanding the financial requirements and being able to indicate to the member states. In the last meeting, they actually indicated that, can you go as our task team to look at this and come back to us with the requirements, right? And we are also engaging already with the European Medicines Agency to establish what they have done over the years so that we can learn as we are setting our own system structures and fee structure in place.
Looking at the way healthcare is funded across many countries on the continent, people are worried that African governments would not commit as much as they should towards funding the agency. And people are worried about most of the money that is needed, at least before the institution of the African Medicines Agency is able to start rendering services and collecting its own revenue, that period where the money is going to come from if our own governments are not committing, if the way health is funded at the moment is any indication. So now, what kind of conversations are you having around the potential implications of having the biggest part of the funding needs of one of Africa's most strategic agency that is critical for health security being funded from external sources?
Well, I'm not worried where I'm sitting. Of course, I know what you're talking about. And when you're saying that most of our health financing is coming from outside, but I think all of us woke up. Our leaders even woke up recently due to COVID. We saw what happened. We saw the issues that Africa really had to struggle with during the time of COVID. And that, to us, I think as AU, we were just discussing internally at some point with our colleagues at the Commission, because we have another program that looks at domestic financing for health. You may know the Africa Leadership Meeting on domestic financing for health. And President Kagame is our champion on domestic financing for health. And he has done quite a tremendous job. And I think we have all seen how some of the changes have happened. We are having quite a number of dialogues with member states on how do we change the landscape, even regional economic communities. We have recently gone into setting up regional health financing hubs to see how member states can share lessons, can learn from each other, can start changing the view of things when it comes to financing the health sector. That's the broad issues around the health sector. However, on the African Medicines Agency, I actually feel sometimes proud when I see how the Commission put its foot down to say that when it comes to setting up the governance structures and the administrative structures of AMA, it is the Commission that is going to fund these processes. When we were setting up the Conference of State Parties, for instance, the first meeting that was done physically by the Conference of State Parties, they funded themselves. Even the subsequent meetings, we've seen the Commission coming up to say, we are going to do this on our own. Why? Because we want to drive the process with the member states. And we want the member states to take ownership and the drive in setting up what we need to put in place as the administrative and governance structures of AMA. And I think we will, and our desire as AU is to continue this way and ensure that we are on the driver's seat when it comes to moving the agenda on access to medical products and technologies to the continent. Yes, you are right. Our partners come in, our partners work with us. We have a common agenda because we also have to accept that we are not existing in a vacuum. We are in a global community, and we still have to engage our partners, and we still have to work with our partners, because what happens in Africa has an implication globally, and what happens globally has an implication on the continent. Therefore, it just tells us why we still need to work together, or why we still need to engage with our partners. But however, I think we have started in the right way when it comes to setting up the governance and institutional arrangements for AMA, because our AU is taking a leadership role with its member states to ensure that they drive the process themselves.
Right. And so you've been able to set your own priorities so far, but now some of these partner countries are nations that have big pharma industries whose interests may not always align with those of African patients. Are you having a conversation or thinking about putting processes in place to make sure that in that give and take process that happens in these kinds of institutions, the African Medicines Agency would be able to strike a balance between protecting the rights and interests of African patients and those of its stakeholders and shareholders and partners?
I will start by indicating that the primary role for AMA is to ensure that we provide a sustainable and secure access to quality assured, safe and efficacious medical products for the people of Africa. And that remains our fundamental principle. And AMA, being an African Union entity, our principle as AU is AU leadership and AU ownership. And in any of the AU institutions, we don't want to lose that, because we want all our institutions to be responsive to the needs of the continent. I want to give an example. Before I even go to the example, I want to emphasize the fact that AMA is set up, as I said earlier, to respond to the needs of the pharmaceutical manufacturing plan for Africa, meaning that our drive is to strengthen local production of medical products and technologies. And in whatever negotiations that we are undertaking, and we are glad, I think, globally, now everybody is starting to align with the agenda on local manufacturing and ensuring that that local manufacturing is responsive to the health needs of the continent. So then I will go to the example that I wanted to talk about. I want to give an example of what we have done on the technical aspects of the African Medicines Agency. We have made significant progress on even coming up with a criteria for selecting priority products for the continent that AMA is going to focus on. How have we done that? Purely African experts through the technical committee that we have set up on evaluation of medical products, consulting with the industry, consulting with everyone to ensure that we all own the process of setting up the priorities for AMA. We have done that consultatively with AU member states, and we have come up and adopted this criteria for selecting continental priority products in alignment with what is emerging from the Africa CDC. So in whatever we are doing, in whatever discussions we are undertaking with any partner that we are undertaking with, they know that it's within the purview of our priorities as the continent. And also one other thing that we did, last year, we developed a continental plan, a 5-year plan on technical support to the AMA operationalization. We did it internally as AU to ensure that we drive the agenda so that when we are engaging with any entity, any partner, they have to align to that 5-year trajectory that we have set up as a continent on where we want AMA or the African Medicines Regulatory Harmonization to be in the next 5 years. We have the other thing is also that to avoid influence of one partner versus the other, we have set up a partnership platform. All the partners meet talk to one plan that is an African Union plan, so that we don't have influence of one partner versus the other when it comes to rolling out any aspects of regulatory harmonization on the continent. And you and me agree that you don't want your regulation to be marred with conflict of interest. You want it to be as independent, as transparent as possible. And that's what we are setting up. We want to set up an independent, transparent, open process that has confidence in the people of the continent, because those are our stakeholders, the people of the continent. They should have confidence in the systems that we are setting up, that they will ensure really quality, safety, and efficacy of the medical products that they need.
And what would you say to people who have the concern that as they exist at the moment, those structures simply don't allow enough room for local actors to participate, that local actors and organizations and so forth are not getting a fair hearing to participate in those forums? What would you say to those people?
I would say that the forums and the platforms that have been established are open to local actors. Now, I want to emphasize the fact that we have structures that have been put in place. And these structures, actually, most of them are driven solely by member states. So in terms of driving the establishment of the African Medicines Agency, we have set up 9 technical committees in the technical areas of AMRH, which are aligning to the core regulatory functions, but also the core regulatory enablers that we need. So these technical committees are formed by experts from the national regulatory authorities, experts from the member states, meaning that they are the ones that are driving the process. If there are any partners that participate in the technical committees, they are actually observers. And there are meetings that if AU member states want to discuss an issue as AU member states, they do it as AU member states. So the drive from the AU on the technical work of AMRH is quite critical. The other structure that I think is also critical is the partnership platform that I've talked about. And the partnership platform is open, is wide, it includes everyone. African, non-African, anyone who is interested in the agenda. Technical partners, funding partners, they sit together, discuss, and agree on the way forward on how to drive the agenda. But as I said, it is all driven by an AU plan that has been developed by AU institutions in collaboration with the member states. And I think one key thing that I wanted to talk about here is that on the partnership platform, you'll be interested that we have the RECs, we have the member states, we have local institutions that include technical institutions, that include civil society organizations, advocacy institutions that are local and international, as well as the funding partners. So it's an open space. And please reach out to us for those that feel that probably we have not engaged with them more. We would like them, actually, we want them to be part of the process. We want all stakeholders, local, international, global, that are important, because as we're setting up standards for the African continent, they are not African standards only. The product that you take here should be at par with the product that you take when you're outside the continent. That's what we are saying. That's why we need other partners, WHO, European Medicines Agency, to be part of this, so that we are at par with them. We want to compete globally and be at par with anybody globally.
So you're putting in place a board which you expect to be in place, all things being equal, by the end of the year. You have the terms of reference, an advert is ready to go to advertise for a managing director for the African Medicines Agency. What kind of timeline are you working with, given where you are at the moment, when you say by this time in 2024, hopefully, or 2025, our director general should be, or managing director should be in place?
I would say very soon. And then if we have talked about the TORs being all set, and now we are having the board being set up, and I wouldn't want to give you that it's going to be in March, in April, in June next year, but I don't think we'll go beyond midpoint next year without the AMRH. I think the AU has taken a lot of steps, and I'm very optimistic that very soon we are going to have the AMRH in place. But even in the absence of the AMRH, there's a lot of technical work that is actually currently going on. Through the technical committees that I've talked about, we have been able to develop continental processes and guidance documents, continental systems that will just be ready to run. We are actually currently piloting continental joint assessments and continental GMP inspections. As we are speaking, there's an ongoing training of GMP inspectors across the continent on that continental system. And the response is overwhelming. Over 300 GMP inspectors from across the continent have registered, and they are being trained so that we have a pool of experts that we can always call on and run. So as we are piloting, even the industry is quite interested. They want to see how robust the systems are that we have set up, so that then we learn, we factor in those lessons, and we improve the systems as we move forward. So we are already moving with a lot of things. Yes, we need the administrative part to also move. Yes, we need to push the agenda on the recruitment and the staffing. But there's also a lot of progress that is being made technically that will make a very huge positive impact on the public health of the continent.
We are in a hurry, Chimwemwe. You know, when you have 70 parents burying children, we are looking at that and thinking, when do we have this agency that can really be there with an office that can support countries, hopefully, so that things like that doesn't happen. But yes, you know, we understand, of course, a lot of this work is ongoing. So are there any countries that are on the path to achieving stringent regulatory authority on the continent?
Yes, there are countries that have made commitment to do that. Look out for Rwanda. Rwanda is doing quite a lot. And their commitment and their zeal to excellence, I think, to me, they will be the next game changer. They might be joining the bandwagon of the ML3 countries. So I think, as I said, with the 27 that we did the assessment on, we saw quite a number of countries and some have even come to us to really provide them with the technical support they need to move to the next level. So we should be seeing more and more countries joining that bandwagon. And I think all of us have to hold hands and work with them and see where we can even advocate for some of the system changes that they have to make, because some of them will require legislative changes. Some of them will require a lot of financial injection and commitment to ensure that they move to the next level. Kenya is also one of the countries that is really, really pushing and wanting to get to the next level. And I think also that's another space that we need to watch, that Kenya is making quite a lot of changes because they want to join the bandwagon of the ML3 countries. But as I said, as a continent, we are driving towards each country moving to the next level, so that we see more and more countries having the basic capacity that they need to attain the next level of maturity.
Excellent. That is indeed what people really want to see. What are you most excited about as a leader who's spearheading these efforts?
I'm most excited about the technical work that is going on, the technical committees, what is coming out of the technical committees. And I think in the next 1 year, I want you and me to look at, and even the stakeholders, to look at the pilot assessment, because that's AMA. AMA is going to be doing the continental joint assessments. So we have set up the systems and processes, and continental systems and processes, and we have set up the continental framework for reliance, where we want really countries to set up their reliance mechanisms to be able to easily take up recommendations from AMA and implement them at the national level. So as we are piloting, it's a pressure test. And to me, the next 1 year is an exciting time because it will tell us, are the systems that we are setting up robust? Are they going to be scientifically at par with any system globally? We are excited that the European Medicines Agency is coming in to work with us in this pilot because we want to see their systems and ensure that we are not very far off. We are setting up systems that will stand the test of time, and we are leapfrogging. We are not going to take as long as they took, but we are leapfrogging to scientific excellence. So in the next 1 year, my excitement is to see that this pilot tells us signals as to where we are going as a continent when it comes to joint assessments and joint inspections of manufacturing sites. The other thing I'm excited about is the fact that you talked about a sad story, the 70 parents that buried their children on substandard and falsified medical products. We want as a continent to set up a robust system for cross-country response to substandard and falsified. And we are developing a continental plan. We are setting up a network of focal points collaboratively with WHO. We are strengthening what has been existing because honestly, of course, there were some deficiencies and gaps that we needed to respond to. So we are developing a continental plan, and we want to set up a platform for knowledge exchange, information exchange, and quick joint response to substandard and falsified medical products. So that's also another exciting thing that I really would really love to see how it evolves and how it responds to the continent's challenges when it comes to substandard and falsified products. Lastly, the last thing that I wanted to emphasize on, there are so many, but I just have to emphasize on one or two.
You need to come back to tell us about all of them.
I think I should.
Yes.
I think I need to come back. So yes. The last thing that I'm also excited about is the developments in the national regulatory authorities. The changes that we are going to see in the national regulatory authorities with the commitment that has been made. And as I said, we have assessed, we know the gaps. We did actually a detailed discussion with the heads of regulatory authorities on what are the pain points. We had a meeting in Rwanda just 2 months ago in August. We had a meeting in Rwanda. We were discussing these capacity gaps and the pain points. And we want to roll out a comprehensive capacity building program from both systems and human capacity. So on the system side, we are going to be working with national regulatory authorities, mobilize technical partners, and also their own internal funding and some partner funding that may be there to ensure that we put in place systems that will bring in efficiencies. And we should be able to measure those efficiencies that we are gaining by improving the systems. But on the on the human capacity, we are setting up an African College of Regulatory Science Professionals. So I think next time we can also talk about the college, how it's evolving and how it's emerging and what it is going to do. So I think this is an exciting part, and also strengthening the regional centers of regulatory excellence that have been there. We've set up 4 new ones on vaccines, and we want to see how we strengthen them over the years to be able to build the required human capacity that we need as a continent for harmonization and for the African Medicines Agency. So
that's it for today. Chimwemwe, thank you so much for coming on to Utano Podcast.
Thank you for having me.